August is National Eye Exam Month, and regular eye exams are an important part of maintaining your health, whether you wear glasses or not. So joining us now is Dr. Anna Neff from Wills Eye Hospital. Doc, good morning. Thanks for doing this with us.
Hi, thank you for having me.
Absolutely. Now, I wear contacts, have worn glasses, can't see anything, and have been the person who falls into that category of not getting my eyes checked as often as I should. So how often should we be doing this?
Yeah, so, annual eye exams are typically what we recommend. For children up to age 64, we usually recommend every 2 years, unless your doctor says, hey, there's something going on here, we need to see you sooner, whether that be a year or every 6 months to monitor. But typically every year to 2 years is what we recommend.
Is it important with the students getting ready to go back to school and all the time that they've spent over the last couple of years on screens and computers and monitors, do they need to get checked right now also?
Absolutely. So, with kids, our schools, they are doing screenings, which is amazing in Pennsylvania, but those screenings, they're not looking at the whole eye itself. They're looking at how well can my child see? Are they reaching that minimum threshold? But they're not looking at the eye in general. They're not looking at how well they're focusing on an image up close. They're not looking at, do they have an eye turn? How's their depth perception, color vision? They're not looking at the eye in general, the eye in its entirety. What we typically say is, with these kids, if they're seeing that minimum threshold, but they say, okay, we'll see you, at the screening next year, if they're not getting tested and they do have these visual problems, then it's spilling over into how the kids are learning, and then behavioral issues and how well they're adapting in school. So, typically, in order for your child to succeed, we like to have a full comprehensive exam.
Yeah, it's interesting you mentioned all of those things, because I did get my eyes checked. God, it's been just about a year now, so I'm probably due. It's not what it used to be. They're doing the whole eyeball imaging and all that kind of stuff. So what happens during your standard exam?
Absolutely. So we are looking at all those things that I had previously mentioned, and then we're also doing a dilated eye exam. So to do a dilated exam, what we do is we put drops in the eyes. It makes the pupil nice and big so that we're able to see back into the retina, which is the back layer of the eye. When we're looking into the retina, and this is not only with kids but with adults as well, we can see over 270 systemic and chronic diseases that can be exhibited in the eye, sometimes not even diagnosed by your primary care doctor. We can see early manifestations in the eye of things like diabetes, high blood pressure, autoimmune diseases, and even cancers. So it's really important to have that eye exam, not only for your eye health, but also your systemic health.
So that's kind of the difference that you were explaining. So a lot of people get a vision screening, like read the lines on the chart, but you need that whole comprehensive exam.
Absolutely.
Okay.
Yes.
How much does this generally cost?
Yeah, we want to take a look in general.
People struggle these days.
Right. For typically with vision insurance, it's a very low copay. It depends on the insurance plan, obviously. Every insurance plan is a little bit different, but it can range to no copay to $40 copay for vision exam. Medical exams can vary a little bit more, but it's typically a low out-of-pocket cost with insurance.
And it matters. It's important. Doc, thank you so much for taking some time with us this morning.
Thank you so much for having me. I appreciate it.
You have a good one.